Hello, I'm Dr. Amy Schreiben. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about fibromyalgia. Fibromyalgia is a chronic disorder, which means it doesn't go away. It's associated with widespread pain in the muscles and bones, areas of tenderness, and general fatigue. Symptoms like these are considered subjective, meaning they can't be determined or measured by tests. Because its symptoms are subjective, there isn't a clear known cause. Fibromyalgia is often misdiagnosed as another disease. Although it is more widely accepted as a health issue, some healthcare providers and researchers don't consider fibromyalgia a real condition. But according to the Mayo Clinic, this factor can increase the risk of depression, which stems from a struggle in gaining acceptance for painful symptoms. Researchers are closer to understanding fibromyalgia, so the stigma that surrounds the condition is disappearing. Healthcare providers are now finding that lifestyle changes may be better than medication in treating and managing this condition. Fibromyalgia is often associated with areas of tenderness, which are called trigger points or tender points. These are places on your body where even light pressure can cause pain. The pain caused by these trigger points can also be described as a consistent dull ache affecting many areas of your body. If you were to experience this pain for at least 3 months, doctors may consider this a symptom of fibromyalgia. People with fibromyalgia may also experience fatigue, trouble sleeping for long periods of time without feeling rested, and headaches. Depression, anxiety, inability to focus or difficulty paying attention, and/or pain or dull aching in the lower abdomen. Symptoms may be a result of the brain and nerves misinterpreting or overreacting to normal pain signals. One theory on why this occurs looks at a possible chemical imbalance in the brain. Healthcare providers may make a diagnosis if you report widespread pain for more than 3 months and have no diagnosable medical condition that can explain the pain. Medical researchers and healthcare providers don't know what causes fibromyalgia. However, research is making it closer to understand factors that may cause it. Some factors include infections. Prior illnesses may trigger fibromyalgia or make symptoms of the condition worse. Genetics. Fibromyalgia often runs in families. If you have a family member with this condition, your risk for developing it is higher. Researchers think certain genetic mutations may play a role in this condition. Those genes have not yet been identified. Trauma. People who experience physical or emotional trauma may develop fibromyalgia. The condition has been linked with post-traumatic stress disorder and stress. Like trauma, stress can create long-reaching effects your body deals with for months and years. Stress has been linked to hormonal disturbances that could contribute to fibromyalgia. An additional theory suggests that the nerves and receptors in the body become more sensitive to stimulation. That means they may overreact to pain signals and cause unnecessary or exaggerated pain. Although the causes are unclear, fibromyalgia flare-ups can be the result of stress, physical trauma, and unrelated system illnesses like the flu. It's believed the brain and nervous system may misinterpret or overreact to these signals. This incorrect interpretation could be due to imbalance in brain chemicals. Other risk factors for fibromyalgia include gender. Women account for 80 to 90% of all fibromyalgia cases. The reason for this is unknown. Family history. If you have a family history of the condition, you may be at greater risk. Disease. Although fibromyalgia isn't a form of arthritis, having a rheumatic disease like lupus or rheumatoid arthritis may also cause an increase in your risk. The goal of fibromyalgia treatment is to manage pain and improve quality of life. This is often accomplished through a two-pronged approach of self-care and medication. Common medications for fibromyalgia include pain relievers, things like Advil and Tylenol. Prescription versions such as tramadol may also be used in extreme cases. They're used sparingly to reduce the risk of side effects and dependence. Antidepressants are also used. Things like Cymbalta and Savella are sometimes used to help treat anxiety or depression associated with fibromyalgia. These medicines may also help improve sleep quality and pain. Anti-seizure drugs such as gabapentin were designed to treat epilepsy but may help reduce symptoms in people with fibromyalgia. The U.S. Food and Drug Administration has also approved the drug Lyrica for the treatment of fibromyalgia. In addition to medication and self-care, you can help cope with the symptoms of fibromyalgia. Lifestyle changes and alternative remedies for fibromyalgia may reduce pain while making you feel better overall. Many of these alternative treatments focusing on lowering your stress and reducing your pain. You can use most alone or together with mainstream medical treatments. It's important to note that most alternative treatments for fibromyalgia have not been thoroughly studied. Research to date fails to support their effectiveness. Many reports of success with alternative treatments are anecdotal. These treatments include physical therapy, acupuncture, meditation, yoga, regular exercise, getting enough sleep at night, massage therapy, and a balanced, healthy diet. Therapy can potentially reduce stress that triggers the symptoms and depression often associated with this disorder. Group therapy is often the most affordable option, and it gives you an opportunity to meet others who are going through the same issues. Individual therapy is also available if you prefer one-on-one help. Ask your healthcare provider for specific recommendations. No specific diet has been identified for people with fibromyalgia. Some people report that they feel better by following a diet plan or avoiding certain foods, but there is no research to support anything definite. If you've been diagnosed with fibromyalgia, try to eat a healthy, balanced diet overall. Proper nutrition can help your body stay healthy and provide a constant supply of good energy. If your diet isn't balanced and you're not eating properly, your symptoms may worsen. You may find that certain foods make symptoms worse. If that's the case, it's a good idea to create a food diary where you can track what you're eating and how you feel after the meal. Share your food diary with your healthcare provider. The two of you can work together to identify any foods that aggravate your symptoms. Dietary strategies to keep in mind are eat fruits and vegetables, drink plenty of fluids like water, eat more plants than meat, reduce your intake of sugar, get regular exercise the best you can, lose weight or maintain a healthy weight. There isn't a cure for fibromyalgia. Instead, treatment focuses on reducing symptoms and improving your quality of life. This is often accomplished through the use of medications, self-care strategies, and lifestyle changes. In addition, you may wish to seek out other people with the condition for help and guidance. They provide an opportunity for members to share resources and help guide each other through their journey. If you have any questions or comments on what we discussed today, or if you have a topic you'd like to learn about, please leave them in the comment section below and we'll get back to you. Remember to follow us on Facebook or on our website, The Boca Voice. I'm Dr. Amy Schreibman. We'll see you next time on Medical Minutes.